The Children's Miracle Network goes hand in hand with the care that we deliver. The Neonatal Intensive Care Unit at Penn State Health Children's Hospital is a level 4, which is the highest level of care that exists for a neonate. And we're the only one in the region. What makes us so special is not just the number that's associated with the level of care that we can deliver or the types of equipment that we use on the unit, but it's the approaches we use to caring for the babies. We do it with a family approach. It's a very comfortable environment. We make it comfortable for parents to be there in a place that would normally be an extraordinarily difficult environment to be in.
Maximus was born 9 weeks early, and when he was initially born and throughout the next couple weeks, he required some intensive respiratory support and some feeding support. He required a rule out for infection, and then just really allowing him the time that he needed to grow and get bigger. And after about 3.5 weeks, he was able to come home, and the rest of his NICU story is sort of history. It was really about our family welcoming a new sibling and helping him heal and get better and get ready to come home. And they did that by talking directly to our big kids. They made them feel included. They made them feel welcome at the bedside. They encouraged them to participate in his care. And Children's Miracle Network provided those resources for us to do that.
That was one of the best things that really helped my daughter, specifically Gabriella. She had never been in an intensive care unit. And then once the CMN provided us with the beads of courage and she could interact with Mac's progress, she really broke down her barriers, and it was really incredible to be able to see his siblings kind of garner around him.
We educate parents from day one, and we involve them in their baby's care the entire time they're there. But it's the extra things that we provide families that isn't just the clinical care of the babies that makes the biggest impact. Children's Miracle Network providing things like the Angel Eye cameras or the Beads of Courage program, some of the educational spaces and educational equipment that we use is what sets us apart to give families the greatest opportunity for success and comfort while they're here.
Children's Miracle Network filled in the gaps that we didn't initially recognize that we needed. We needed a coffee break. We needed a meal voucher. We needed sometimes just a toothbrush. And Children's Miracle Network just sort of shows up unannounced, quietly behind the scenes, and they give you what you need.